Hello and welcome to another exciting morning on Jasiri, the place for bold and brave conversations. I'm Tolulope Adeleru-Balogun.
I'm trying to...
Cut in the act.
Okay.
There was a cut.
I don't have any Adeleru. Oh, I said Adeleru. Blessings. It sounds so sweet. Anyways.
Wow.
I am the ambassador for the Gen Zs, reporting for duty. I'm Blessings Mosugu.
Okay. Back from market runs, and I'm ready to tackle all the hot topics that we have today. My name is Omotunde Adewale David.
La femme qui parle beaucoup de langues, la femme qui parle FX, je suis ta tante, je suis ta maman, je suis ta sœur. Bonjour à tout le monde. Même si je suis tout ça là, mais also at the same time, mais c'est un take Christ now, I'm still a street chick. Ndo, you don't see, I won't want to send Kamindo. Bonjour à tout le monde. Je m'appelle Katherine Obiang. Welcome to Jasiri.
Catherine, this is an English show. The last time I checked.
I know.
And you're always showing off.
I know.
It's about I'm not even going to lie. I like the way she sounds. Well,
Blessings, can you be on my side?
Don't hate the player. Learn from the player.
No problem.
I'm such a lyricist.
Wow.
I just feel like my portfolio keeps growing. I'm wearing so many hats.
One of these days,
so
all your hats are just going to come tumbling down.
Yeah.
Wow.
Yeah.
Really, they hate
So
Shen.
no, that actually sounds like hate.
Yes, totally. It's totally hating.
No, but
I'm going to let
first you were
John, I'm
hating
going to
on my
speak
crackers.
Dutch. Don't let's go to the cracker story. Do you want us to share with the viewers?
Okay.
She would have just said she wanted crackers.
Guys, no.
I missed something.
No, you did.
What happened?
The crackers. Wow. Today was a story of crackers. I didn't know that Lolo could come up with so many sentences with the theme of crackers. It was
so let me give a quick backstory. I walked into the makeup room and then I was having crackers because I woke up very hungry. I don't know why. And nobody said they wanted. I should have offered.
Wow.
But like nobody said they wanted. I was just so hungry. I was just stuffing up my face with the crackers and Lolo didn't see anything. Then I stepped out and came back and then she was like, that crackers would choke you.
I see Lolo went into it.
Did I use the word choke you?
It was similar. I mean, you were threatening my
I
life.
meant you were going to drown in crackers.
Exactly.
But Lolo, there was crackers in my shopping list that I typed
We have
yesterday.
a show to run. Tolu, please, can you get your girls in?
No, my shopping list now. You said you would get me Gary. You said
She's going to throw you a punch.
Catherine, because I went to the market last week. Sorry. Anything I get from yesterday, anywhere I go to the market, anytime I go, all the goodies they give me, I take it.
Oh my God. Okay, let's reconvene back to what we know is the agenda for today. I don't know what just happened. I missed the cracker saga.
I'll fill you up.
You are a show off. Don't worry, you're a show off.
And you're a hater.
Wow. All right. So I think at this point in time, we might need to do like a comedy special with Blessings because we are constantly being bombarded. Then also you're going to have to pay us because me being your guinea pig for your jokes doesn't come for free.
Okay.
Well,
Okay.
I mean, we're going to have to sign an agreement or something.
Pause. All right, so ladies, let's get back to the agenda for today. We have a packed lineup this morning. In just a moment, we'll be talking about the crisis in the healthcare sector as the Nigerian Medical Association, of course, has threatened to strike over salaries. And then we'll also be debating some hot stories on the show. Remember to join the conversation on our social media handles at News Central TV and of course using the hashtag Jasiri. Stay with us because Jasiri returns after the break.
Thank you so much for staying with us on Jasiri. Now, one thing about the Jasiri ladies is that we can be such a playful bunch. You see, Kat is laughing. But that doesn't mean that's okay. That doesn't mean that we don't know how to get down to business. So this morning, the focus is on Nigeria's healthcare sector, which, as you know, faces numerous challenges, ranging from inadequate infrastructure and funding to a shortage of qualified healthcare professionals. We've been hearing about brain drain for the longest time, compounded by the brain drain crisis, of course, due to the JAPA movement. Poor administration is also one, and response across different levels of government have also played contributory roles to further internal crisis among health workers.
And just in December, the Nigerian Medical Association issued an ultimatum to the federal government to implement the upward review of the consolidated medical salary structure by the 31st of January 2024 or risk industrial action.
But then strikes are not new to us, and it's not unique to Nigeria or Africa. We've seen this happen across several sectors, but in the aftermath of the COVID-19 pandemic, there's no gainsaying that health is indeed wealth, and addressing these crucial issues are necessary for improving healthcare delivery and outcomes in Nigeria.
Now, the government has made promises, and the NMA intends to hold them to those promises. So joining us now to discuss fixing Nigeria's healthcare sector is the Nigerian Medical Association Lagos Chairman, Dr. Benjamin Olowojebutu. Welcome to Jasiri, Doctor.
Thank you for having me, guys. How you guys doing?
We're doing good.
I saw the way you were looking at her.
He was
Just get my name
waiting for me.
Just get this name wrong and I'll show you.
That's what made me start laughing.
It's good. So let's start with what we see as the issues or what's happening. There's a lot of disgruntlement, very obviously, in the medical sector, not just the doctors themselves, but across health workers. And we also realize they're also human. They're feeling the impact of whatever is happening to all of us as Nigerians. How dire is the situation that Nigerian medical doctors in particular are facing?
Thanks for having me today. I appreciate this meeting. It's very, very, very sad that we're living in very bad conditions right now, that things are not working the way we expected them to, and many doctors and many healthcare professionals are feeling the brunt. The economy is really bad, but so it doesn't take away who is a doctor, who's not a doctor. But for doctors, because of the issues of JAPA and low turnout of medical doctors and health practitioners, the burden on the doctors are very, very heavy now. You see doctors now getting very sick. We don't have special medical insurance for healthcare. You see doctors have kidney failure. He has to pay out of his pocket. And you see doctors now trying to get people to support them in media and doing videos to get health support. So the burden on ourselves is heavy. You see 5 doctors are supposed to see like 200 patients a day. You're now seeing 2 doctors seeing 500 patients a day. So it's a lot of stress on us and everything. So for us, it's about thinking and making healthcare like an emergency and say, okay, how do we fix these problems now, bottom up? Not just casting aspersions or bringing some international ideas that will try and transpose to Nigeria. No, we must have local ideas because we have cultural background, we have different kind of setting. Use our ideas to solve our problems. That's the right thing to do now going forward in healthcare.
Most of the time when we have a major crisis in our hands, there's an African proverb that says when elephants fight, it's the grass that suffers. That means with all this rancor going on, with all this bickering, all this talk, it is the people, that need to access this medical care that actually suffer some of this crisis. And I know that recently there's, I think, a memo from the Medical Dental Association that says that warned doctors against striking and shutting down healthcare sector.
That's very inappropriate. I tell them that they don't have that right because there's international labor law that talks about strike. It's very legal. So that message that they sent out wasn't very appropriate. We have told them that it's not appropriate to say that. Number 2 is that we feel bad. Particularly, I feel very bad for the patient. I feel very, very bad, and I apologize sometimes because it's not their fault. It's a system. A system has failed. So if that's failed, for example, now you see the drug making company that left the country because of lack of political will. Somebody came into Nigeria in 1961, and then it was told that when you come to Nigeria, you must build a world-class factory making drugs in the country, make it local. But you've not done that in 51 years, and you just pack your bag and baggages and leave the country where you've made a lot of money from. And it happened in China. They wanted to do it in China. China didn't allow them to do it. Even in Ghana here. Now, but they're done in Nigeria because there's no political will. So a man that is hypertensive that needs to take medicines every day for 30 days, that's costing 5,000 naira from his salary. Now he's now up to 50,000 naira.
Yes.
So it's not going to get well because he will now have complication of the problem, and he can't get drugs because there's no money for him. He can't even feed himself. So he now goes to the herbal medicine guy that says take one particular thing that can cure you, and he now die. So for me, I feel very sad, and I apologize to Nigerians that we're in this space. But I think there's hope. I hope there's hope.
Why do you say so?
Because now there's a Ministry of Health that has added social welfare to it.
Okay.
Before it was just Ministry of Health. So I believe that part of social welfare is to cater for the vulnerables. I hope so. I hope that's the vision, where the under fives, the elderlies have a particular budget for their healthcare, where they have drugs for them somewhere that they are disbursed to every local government in Nigeria, subsidized, yes, so that people can get access. We have Nigerian Health Insurance Authority, and is a mandatory scheme for everybody in the country, every informal sector, formal sector. But what is the access point? What are we doing about the media? What are we doing about people information? You know, I remember back in the days when NOA started, Nigerian Orientation Agency. You know, when there's an outbreak of cholera, you see them, there are jingles everywhere, you know, everybody information. They're there now. So for me, it's about when you say NHIA is now mandatory. Who knows about it?
Who knows about it?
In the rural community, I'm sure most of you even know about it. You know, in rural community, the guy far in those villages, I didn't know about it. You know, back in the days, NOA would do jingles in Hausa, jingles in market activations, you know. So those things are important for people to know the access. So for me, Nigerians should help us pray. Also help us also plan together, because we believe that the budget of this year, I was expecting that.
Okay. So because we have details of the budgets that we actually wanted to take you to, so we'll get to that. But I want to still stick on this, because there are a lot of times when the strikes come and patients are shut out of healthcare services. People will tell you, what about the Hippocratic Oath? First, do no harm. And a lot of times, it's a difficult compromise. You want to demand your rights. You want to demand what is accrued to you. You talked about international labor law, but we're talking about the lives of Nigerian citizens, children, mothers, fathers, loved ones. Is that not more important than, in a way, demanding Is there no way to strike and still take care of patients?
I like that part. You don't say it's not more important. Let's balance it. So because everything is both important. Because if you cannot feed your family, if you cannot feed yourself, you can't treat anybody. Because we all go to the same market. In the same market, there's no same market for doctors, market for, you know, or we all go by the same fuel. You don't say fuel is your own, is 20 naira, because you're a doctor now. So everybody has the same economic crisis. What I say is very simple. We apologize. It's not in our mind. It's not in our nature to want to go on strike. It's just simple. Let's make this work enabling. Give the healthcare workers an enabling environment to do their work. It's the duty of the government. It's their duty. Just because you are government, your role is to give us welfare and security as a government. So if you play your role, we doctors are ready to sacrifice our lives, our work. Okay, look at what happened in Ibadan yesterday. Over 70 medical doctors were there till 4 a.m. because of Hippocratic Oath. Nobody paid us extra money to be there. But they were there on standby, evacuating people, giving first aid, taking them to UCH and everything. So for me, I don't want us to look at it like we're not being nice to the people. I want people to think about that. We have suffered, we have labored, and they should help us think that if the government can help us, we'll be able to help them more.
Yeah. I mean, so why does it feel like this? Why does it feel like the sector is not being prioritized? You've just said that the healthcare workers are pulling their weight, for the people, but it doesn't seem like the government is doing the same. I mean, if government officials were mandated to, take, let's say, health services from Nigerian doctors, would the case be the same?
Yeah, you're a great woman. I was going to say that today.
I am, right?
So I say to people, when you love your country, the first thing is to use the country, which means if you want to fix the system, use it. You shouldn't say because you have capacity to use taxpayers' money and take and you have a headache and travel to the US or the UK because you have access to the money. But if you say that we are proud Nigerians, let's be proud Nigerians.
Put your money where you know.
Yes, the politician says, I'm going to do my blood pressure and sugar check at that local government PHC as a chairman. What he would do is that it will make that PHC center popular. And people will say, if my chairman can use that PHC, trust them, I will use it.
I would use it.
Now, somebody said it. One of the House lawmakers made a very funny appeal bill last year that was quashed. And I told them, I said, if you are saying that doctors shouldn't leave the country after 5 years, why do you as lawmakers say, okay, do a law that says your first 4 years as an assembly member, use facilities in this country? If you go to a place that is not working, you will see it's not working, then you'll be able to fix it. So the point for me is that all of us as Nigerians must be very, very, must be very, very honest to ourselves. Honesty and love for the country. It's not by mouth, by actions. Yeah. So people can see, okay, there is no ambulance here. It's not working. Yeah. I am the House of Rep member representing this local government.
Local government.
I would provide it because it's going to help my people, my mother, my mother's friend, my sister's brother's father. Things like that. So for me, it's about genuine patriotism, not because of position, but because of service. It's very, very key. So if government will say, these doctors are they not trying? Yes, they are. Why can't we provide for them? Let me shock you. Abuja Declaration says budget of health should be 15%.
Yes.
There's only one state in Nigeria doing it, Benue State.
So not even Lagos.
No. Not even Lagos.
And I appreciate the governor.
Yeah.
Even the federal government is doing about 4.9% of the budget. So if you want to take Nigeria healthcare seriously, you will provide funding for it. Yeah. Now we have added social welfare. I think that should have increased the budget because there's another branch of it, but it's still the same budget.
So let's get into that because I know we have some details for that. So allocation for the health sector is 1.33 trillion naira. As Doctor has said, that's just about 4.8% of the federal government's 2024 budget draft. Now, compared to other sectors, the question also has to be, is that enough? Should we also be seeing a double-digit percentile to know that the government is taking health seriously? So we have security, which tends to take a large chunk, but it's not as much as recurrent expenditure, issues around, of course, at this point now, debt servicing as well. So we find
government
a situation, government servicing, we find a situation where health is just down on the totem pole and education as well. And I want you to answer this, also telling people, how much is the average doctor who works whether at the federal, state level, or local level making? People really need to understand what is being given to them to take home that doesn't take them home.
Okay, so it doesn't take them home, first thing. But let me answer the first question. So there was an Abuja declaration because every ECOWAS came together and said that, and the African Union said that, okay, Africa is a big continent. Yes. And we're not taking ourselves very seriously because we keep getting funds from donor agencies. There's no accountability. They pump money into the country. We don't see what's going on. You know, we just write papers, write stories. COVID came. You know, we had a lot of money from COVID. We had a lot of donation from COVID. I'm sure if another disaster comes again, we'll start looking for money again because we're not always prepared. Remember Ebola happened? Ebola happened to us. And when Ebola happened to us, I thought Ebola would give us an outlook of how to prepare for disaster, but we're not ready again. We're not always ready because we always wait for the donor to come.
Reactive.
So Abuja Declaration says let's make minimum of health budget to be 15%. Minimum, which makes sense, which means primary health care, secondary health care, tertiary health care, funding for vaccination, funding for training, funding for salaries, for remuneration, funding for infrastructure development and everything. But look at it, we're still at 4.8%. So imagine yourself that you have everything from infrastructure to salaries to promotions to health activation to local government impact to awareness to salaries to trainings at 4.8%. But what it means is that every of those positions will be inadequately funded. Inadequately funded, which means that you won't get proper salary, you won't get proper training, you won't get proper everything. You will not get proper recruitment because you cannot afford it. What I have advised is very simple. It's easy. First line is accountability. So you look back at your budget deficits, budget workings in the last few years. What is a priority of the funding you need as a ministry? First thing is your healthcare workers. You must make them very comfortable to love and serve the country.
Let me just hold your thought on that, because when you just pointed out that we all know that this JAPA syndrome has caused a lot of gap in the industry, medical industry. And from even the feelers that we're getting, it's not as if they're getting the best of remuneration even abroad, because it's commonplace. They know that, okay, Nigeria is having a crisis in the medical sector. That is why a lot of our doctors are just, eloping and going to other climes to get better. So would you not say that there is something that the government can refocus to see if we can even entice some of our doctors back home? Because
it's very easy. I've said it before. Make the working conditions enviable and enabling.
Where would the money come from? They're going to tell you that.
Let me say a few things, Lolo, so you understand what I'm saying. And it's very painful. You see a medical doctor going for call at night, and is kidnapped, and is maimed, and they send his body to his family in a very gory picture. How do you now tell another doctor that it's good to serve the country? So security, one problem. Infrastructure, another problem. What do you need to work? Your call rooms, are they properly sorted? Your emergency, are they properly sorted?
So everything is mitigating against the doctor who's left.
Who's left? So some doctors didn't leave because of money. They left because the working conditions were very dire. Because
and then, I'm sorry, but you also did mention that hope is another thing. Like, if you even know that these people have you in mind. I mean, recently, the federal government was begging other countries not to take doctors from Nigeria.
You can't do that.
You can't do that.
You are begging other countries not to bring in Nigerian doctors.
Which is why I wanted to ask him that you must have had friends, or you must have friends who have JAPAs. And I would like to ask you what the experience is, because Lolo said something that, it's not necessarily because it's better.
Yes.
Environment.
Totally, exactly. So I was going to ask you, what kind of feedback do you get from?
It's simple now. The kids go to proper schools. Yeah. Probably it's free. They don't pay a lot of money for that. They have light. They have light. Yeah. They work hard too. Yeah. They have light, but everything they need to work is available for them. They don't need to call for anything. It's available. So there's a system that works that says, if you need so to get your work easier, it is already there for you. Yeah. You don't have to ask for it. But here in Nigeria, you ask for everything because they're not available. And because there's no system accountability. Somebody's role is to provide you gloves in a particular unit, and they will allow you finish. And now asking, hello, where's gloves? You don't need to ask for them, because if the system works. And why? It's because hope, no hope. Because people don't even see that the government is serious about improving access to healthcare. Yeah.
Well, why did we now let it happen? Is it because it's a Nigerian thing? Because sometimes we say, oh, let's just see as it goes. You know how we do anyhow, that Nigerian factor. How has it been left to deteriorate? We've always known that healthcare was terrible in the country. But over the years, over the decades, how have we sat still?
Because people are very selfish. We have very selfish, self-centered people, elevating people that don't think about the people. I had an accident myself. I almost died as a medical doctor. I almost died. And God just helped me. I'm alive today with a bad leg, but good. But the point for me is that we must think about the people than ourselves.
Now when you say think about the people, because we've been talking about the challenges. And one of the things that I see as a way out of this dire situation is to get funding. Yes. And if government is not funding, let's even say, hypothetically, they're giving 4.9 out of about 15%, which is so meager. And how about this insurance scheme that you said, you spoke about? One, they are going to get this money from taxation. It's a kind of health taxation on the people. That means they are paying for their own medical care, so to say. Would you not say that we should focus on getting that working? Because before you turn around, you're going to start to hear about how we are beginning to see a lot of hanky-panky, put their hands in. Monkey will start, the insurance money will start to go away. Okay, so what can we do to focus on insurance and make sure that even if they're not funding, at least doctors are getting money from the insurance that the people are paying for?
So two things are important, and I've advised and I've appealed. Doctors, healthcare workers should have what we call medical insurance. which gives doctors access to health care whenever they are ill. Can I shock you today? If any doctor has an accident today, he will pay from his pocket. If a doctor, I paid heavy for my surgery, heavy, a lot of money. Why am I serving a country that is not thinking about me?
In a critical position.
In a critical position. Number two is that NHIA is now, it used to be NHIS, now it's NHIA, it's not an authority, as a DG, that is not mandatory for Nigerians to have health insurance. But can I shock you? Only mostly the civil servants are those that understand what insurance are. What about the informal sector? What about people that are in the market? Those are guys that are organized. How did they know about it? How did they get their money deducted from that? How do they make them feel safe to put their money in insurance? So you must one is the infrastructure. So you say we have 774 local governments in Nigeria. Maybe you have only about 300 that has a primary health care center. And you tell people, okay, the very, very basic of primary health care in this country, the malaria, the typhoid, the antenatals, the delivery, is primary health care. But you now tell somebody that is maybe somewhere in Kano, in one rural government, please go to the hospital and deliver. It sells to you. There's no bed in the hospital. There's no drug there. Let me deliver my house.
Of patients getting IVs under trees, outside of a physical structure, because that is the state. Okay, so Dr. Olowojebutu, I apologize for interrupting you, but because of time, we have to move the questioning on. Katherine, I know we have a question on the SDGs, and then we'll wrap up from there.
The steps in the enemy that they're taking to achieve the targets, what they say SDG goals. Now, I'm interested to know, because if we say achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now, that is a mouthful. It is. Where are we going? How does it look? As in, this is the target that the United Nations has given. Like, it is plenty in the mouth. It sounds nice, it sounds perfect, but is it realizable? So
first things first is, are we ready for it? As a nation, are we ready?
Well, we should be. We are.
You're not a doctor.
You're not a doctor. You're not a government.
No. So first thing is, somebody must drive a change. It's not the doctor. It's the government that owns the country. Then we're not translate it down to every sector in the healthcare space. Achieving universal healthcare talks about everybody in Nigeria feeling safe to get access to healthcare anywhere they are. Baseline. We must solve the primary healthcare problem in this country. You know why? Most guys that have even malaria and want to deliver now go from their house to tertiary institution.
Yes, we're bypassing the primary, the local aspect.
Have you seen local health?
Nothing happens there.
Nothing happens there.
Because we have not funded one, and because they are not accountable to anybody.
Yes.
What they've done in this country, and it's very, very funny for me, I ask why. So you have federal government, you have state government, you have local government. Local government is not answerable to state, to federal, they are all different sector governments. Autonomous, and they're not answering. Nobody is asking questions about what are your deliverables. So if you say you have this local government, you do an election, you have maybe 100,000 human beings there. What's your budget per head? What's your GDP? What do you spend on health per patient or for this local government? How do you get your budgeting right? How do you get your budget for a local government? How do you say this is what I spend on healthcare? Do you just do it just a random figure? You say, okay, we have 10,000 old people, 2,000 young people, and this is the money you're going to spend on each of them, and you put in a budget, and you're accountable. Because so the House of Assembly will ask you, come and present your budget. What have you done in the last 2 years? Have you done this? And somebody is accountable for what is spending. In Nigeria, we're not accountable. We just spend money anyhow. So right now, what NMA is doing is to make sure we are accountable. Government is accountable. And says, okay, if you are spending, if you have 10,000 medical doctors in this country and 2,000 doctors have left, make sure those 2,000 doctors are naturally replaced one-on-one. Because now there's a lot of bureaucracy. Before doctors are employed, they have to go through a lot of work. Now, so when they leave the country, Make sure that people that are ready to work in this country, replace them immediately so you don't overbody the doctors. That's how you have access. Because first access that people are available to do, see the patient.
To do the job.
To do the job. Right now, people are there, there's access, there are spaces to fill in, but they can't get to the job. But I heard what I said yesterday's effect meeting was very good. The effect meeting said one of the reports is that they've reduced the bureaucracy. So they've given the parastatals autonomous to get one-on-one replacement now, and that's very good.
Okay, so before we let you go, final question to wrap this up, and I think I need an answer in 1 minute before the producers have our head. There's a potential for a strike action from January the 31st, with expectation that maybe government under the Tinubu administration does not meet up to the demands of the NMA. If your demands are not met, is a strike going to happen? Let me finish. I want to add, I want to buttress my point. Okay, very quickly.
Let me answer you. So there are meetings that happened in the last few days, and there's a lot of progress. A lot of progress.
Fantastic to hear.
The national the leaders of the NMA nationally, led by the president, Dr. Olowojebutu, had meetings yesterday, day before yesterday. They have another meeting today.
Fantastic.
So it looks very, very good.
Promising.
Yes, promising that. Because it's not in our being, our joy to go on strike. And I'm sure the president knows that, and he would work it out and will not go on strike, and our funds.
And so finally, I've heard on Twitter, and I've heard it said that right now, it is not the best time for any Nigerian to fall sick. You are the doctor in the house. You have the background of how much loss we've had in the medical field, people leaving. What's your best advice right now when it comes to health for Nigerians, given the current state of the healthcare sector?
Number one.
Don't fall sick.
No. Number one, eat balanced diet.
In a country where food is very scarce.
You saw the inflation figures for food prices.
I get it.
What do you call that?
Number two, make sure you don't think about Nigerian problem a lot.
Your BP will go up.
It will go up.
BP will go.
Number four.
Number three.
Please try and laugh a lot.
Wow.
That's why we're here.
Well trained inside.
Alexis has a comedy career coming up. She's going to be the answer to Nigeria's problem.
Number five, make sure you do your blood pressure at least once every week.
Okay.
Once every week.
Okay.
We'll have to leave the conversation at that, but it's fantastic to hear that meetings are taking place, and it's very likely we can avert the potential of a strike coming January the 31st, and we look forward to having more updates. Dr. Benjamin Olowojebutu, thank you so much for joining us.
Thanks for having me, girls.
Thank you.
Fantastic. All right, Catherine, what's coming up next?
No, I was
Still laughing.
No, I was going to say no. It's the way, Tolu deliberately pronounces his surname. So, and we get that. I couldn't have done it that smoothly. Trust me, sir, Well,
so that's why I said it.
Thank you, sir. Hot Topics is next on Jasiri. When we return, we'll be delving into the Hot Topics for today. You don't want to miss this. We'll be right back.
Welcome back. You're still watching Jasiri, your favorite show. And before we went on break, we're talking about the deteriorating health sector. And one word that kept ringing out was hope. Look, in this economy, in this situation, you should hold your sickness. Do not allow yourself to fall sick because it's not even funny. I mean, if you're just tuning in, this is Jasiri. It's a place for bold conversations. And you know what's interesting about Nigeria? Everything is newsworthy. And even when you think it's not, it is. Nigeria itself is breaking news. In fact, the only thing that is true about our anthem and our pledge is, oh God.
Bless you. She was preparing for this. You know what people say? Like, I've been preparing for this moment all my life.
When they say don't fall sick, that's why I'm here to make you laugh. For free.
You could not even interrupt her. Blessings was on the roll.
Anybody that said anything out, just go.
And even the doctor said as he was leaving, he said, you know what? Make sure you have a balanced diet. You're laughing as much as possible. You're also, of course, checking your blood pressure. You're not thinking too much about Nigeria's problems. He was leaving us and we're all joking and we're all agreeing that a balanced diet in the country does not balance.
I'm telling you, nothing is balanced.
I'll come to
You just have to try. You just have to try.
Laugh a lot. Don't cry inside, though. Laugh a lot.
Talking about laughing a lot, well, try to balance it all out. There's nothing certainly funny about what we're going to be talking about on Hot Topics this morning. Yesterday, we had touched on the blast that rocked the city of Ibadan at about 8 p.m. That was on Monday night this happened. Authorities now say it's caused by illegal miners. So far, we are aware of 3 fatalities, and guess what? 77 injured persons accounted for in the aftermath. Now, this is not funny.
Yes, you know, that's not even the story. There's still another one. A video emerged online of a prophet in Osun State who said he saw and prayed against tremors about 4 months ago. Just listen to this. Let's just watch what he has to say.
Well,
maybe the video we don't have it
for the video.
Yeah.
I do not mean to be a pessimist, but why is it that it's after these things have happened that we now
the
start seeing
videos start to circulate? But you know when some of these things actually, when this let's say prophecies come out,
yes.
a lot of people do not put so much credence to it. Yeah. Everybody just thinks, okay, the prophet is just, you know, giving prophecies until we begin
among the prophets that, you know, speak the truth. They're among the fake. That even the Lord said,
so
not all will make heaven. So you know, when you hear prophecies like that, at first you give a partial leaning to it, and then you don't take it seriously until it actually happens. Now the guy is trending.
So we have the video now. So let's go to it and let's hear what the prophet said.
Not so long from now, you will hear in the news. Not so long from now, where they said there was a light tremor. Once you hear that information in the news.
Hallelujah.
I saw an angel say to me, that's why I paused. He said, I'm coming. So I saw him leave with speed. Then he got to Ibadan. As he got to Ibadan, I heard like a very loud shaking. Then he returned quickly. That this will be a sign. It's just shaking in the earth, just a light tremor, something. Don't worry. Once you hear that information in the news.
So for me, the tremors, and he said a shaking in the earth, that is reflective of earthquake, not necessarily an explosion.
We don't have earthquakes in Nigeria, so that's like the closest.
That's why you're wrong. You'll need to look into your history. Nigeria actually does sit, some parts of Nigeria do sit on tectonic plates, which when they move are the reasons we get earth shakes, earthquakes.
But not so often.
But not so often. So it's not that it's not in our history, but it's not a regular occurrence for us along the valley.
So this is one of those ones.
Yeah.
So my thing is, I want to believe that prophecies are given to avert crisis.
Exactly.
So if we always have these prophecies that there's doom coming, and it's not like the doom is for the bandits we have, the terrorists we have. No, it's just for innocent victims, people, you know, dying and stuff. So why the prophecy?
No, but my own challenge now with this, because Nigerians, we tend to spiritualize everything. But the bad thing again is because of the charlatans in the spiritual space, make it a bit tough. Because imagine if you took a prophecy like this to the governor of the state and asking them to do maybe a little bit of checks and balances. But because there are charlatans amongst them that go there to seek remuneration and, you know, cutbacks and money.
Yeah, but don't they have...
They might not take them serious.
Yeah, but you must also have the ones... Don't they have... I don't know how it works in the religious space. Don't they have the ones that check and balance that, okay, help me check
but these prophecies are just like... There's no science to it.
There must be a translation to the speaking in tongues. With prophecy, a prophecy can come through just one person.
Yeah, but okay, Blessing said something about averting. If you know, there's information...
But it was live streamed September 2023.
That's the thing.
Some people will tell you that we're the ones who didn't catch the message.
If we didn't catch the message, okay, something is bound to happen. There's a tectonic plate dancing around, you know, one day it's just going to bounce on all of us. I had to say that the way Tolu was very well put together with tectonic plates. I had to say, wait, what?
Okay.
But okay, so we had been given, or this message had been given. Could there not have been someone to pray against it?
No, let's even say, Catherine, let's even not spiritualize it. Ever since I've been young till I'm older now, we have heard...
Obviously.
Wow. Just bless
Gen Z.
I'm going to make sure that cracker issue will revisit it.
She will dream about the crackers.
But you know, even jokes upon, we've been hearing about flooding. We didn't hear that from spiritual balances. We've been hearing it from the weather forecast. We've been hearing it from the proper channels. But yet we still have flooding. We still have places where people lose their property, their lives in flood situations. So even though that is not even spiritual, we didn't do anything to that. It seems that all we do in the country is just react.
And that's
we say it and we leave it there. So it's not like they're giving us the information because it's going to avert anything, like Catherine said. It's just knowledge. How do we now begin to move? I remember the time that we had COVID. Remember that we had to wait for weeks to get hazmat suits so that the medical professionals can get into the spaces and begin to give medical care. He said that we're going to always wait. Remember again that we had a time where there was a building collapse and we had machines that were supposed to detect
if people had
maybe ultra red violet rays or something to detect. We didn't know how to work it, and they were our equipment. So that means we just listen to these things, even if the prophecy was more specific than that. That they even told us the date it will happen, when it will happen. We're just going to listen to it, and it will still happen because we don't do anything.
So, ladies, I know it's heavy, and we're continuing to follow up on the situation in Ibadan as, of course, it's playing out. I'm happy, unfortunately, to hear fatalities right now are limited to 3. I'm actually surprised. That's the word I was looking for. Surprised that fatalities are limited to 3. Our condolences go out to the family of those who have lost their lives in this situation, and we're continuing to think about those who are recovering, and we hope that we can keep the fatalities down. But we'd like to end Jasiri today on a lighter note, and that's because of an interesting tweet from Zainab Balogun, Nollywood actress. And if you can put that tweet up. So she says, a woman confronted her boyfriend about a hotel reservation for 2 that she found. And when she showed him the A4 paper, he took it and ate it. He wasn't about to confess. Later, he told her he was hungry, and she brought him 2 pieces of paper for dinner. I wish I made this up.
No, I'm interested to hear. I'm interested to know where Zainab got this. I think this information is so accurate. The way she has put it together.
She's like she heard it from the woman.
Just to see.
Men will stay you
piece of paper. Is it the A4 paper that she brought?
As in, if you just take it, snatch it, crumble it, and swallow it.
Why? I saw this video where the lady caught her boyfriend.
Everyone is just laughing out loud.
So a lady caught her boyfriend cheating, and then she confronted him, and this guy sat in the bathtub,
was crying.
I
saw it.
And was wailing, like he was literally crying. No, you're gonna leave me.
I don't know why.
I saw that video.
I don't know why I did this to you.
Are you kidding me?
I'm so sorry.
But isn't that
you
sweet?
Don't deserve
It's sweet.
It's manipulation of the highest order.
Manipulation.
If they did that to you, you'd like it.
No, I'm not saying
No, but
that.
I would enjoy the drama actually. But when you're done crying, I'll still throw your thing.
Because that's why. Please, can we come back to the fact that he said he was hungry and she served him 2 pieces of paper?
I would like to know. Is it the full A4 paper? Or she cut it in
Let me raise my hand here.
That is serving
One of the
breakfast.
questions I hate most in my life is having to ask, what are we eating? And if the answer is, I don't know. Now, you guys have seen those TikTok videos where the ladies will fry, I don't know, or anything and serve it. This was the prime place for her to have served him 2 pieces of paper.
I guess it's safe to say that the guy ate and left no crumbs.
No, blessing. That took it.
Manager, we're going on a tour.
Oh my God.
Blessings.
That was so odd.
Okay, now it's blessings.
We can
cross of her name. Yes, in her lineage. Like no other.
Blessings. Fall on me. Take your flowers.
Blessings.
Fall on me.
Oh my God. Take your flowers.
I don't know what to say because at this point, blessings is leaving me speechless. It rarely happens, but apparently it's happening today.
I just can't help it.
I
didn't see that coming.
But honestly, I'm just happy that everybody is taking their power back. Haven't you noticed? Women are beginning to take their power back. And that makes, good for us men.
Men also take your power back if it applies to you as well.
If you
but
can.
most importantly, is preserve your mental space.
And of course, with doctor's orders, laugh. So come to us.
Come to
Meet us on Jasiri, 10 a.m. West African time, Monday through Friday. We will hit on the important conversations, but we'll make sure that we leave you with some laughter. And as you can see, we're living up to the name.
Tolu, don't promise what you can't keep everything.
I'm here now.
I'm a promise keeper.
No, you say you
Ladies, we're heading out. Please have a great day. We'll see you tomorrow, 10 a.m. West African time. Do have a good one.
I'm feeling
Bye.
myself.
I thought you were going to walk off set.